The next manual therapy we're going to perform is a self-manual therapy of the lateral hamstring, so the hamstring section near the outside of the leg that connects also what's called the iliotibial band. So I'm going to use Brian here as a model to help demonstrate this. So what we're going to do is we want to make sure that we have some shorts on, so we don't want to try to go through any piece of clothing. So what you want to do is you want to be able to pull up the pant leg a little bit higher, so like right up about to the hip here. And you want to utilize a little bit of coconut oil. So this will be a little bit of lubrication, so that way you're not pulling on someone's leg hairs, especially if you're a guy, or irritating the skin. So I want to add a little bit of coconut oil to that area. So what we're trying to accomplish with this is to release the area of the hamstring and the iliotibial band, which is the muscle that goes on the lateral aspect, the lateral side of the upper leg, and release that. Well, what will happen is that if this gets tight, you can cause a lot of other different low back, hip, knee issues. So what we want to be able to go and release is, and be able to do this ourselves, one of the tools we want to be utilizing is what's called a T-bar. So a lot of times most people's hands aren't really strong enough to be able to get through this and to do this properly, mostly because of the fact that their hamstrings and your IT band are a big muscle. So you really can't try to do it so much with with your hands. It just irritates your hands too much. So what we're going to utilize, the T-bar starting from the knee going up towards the hip. So if I were to go and place a little bit of pressure, and you always want to be gentle with this because of the fact that this is a very, very highly sensitive area. So if I were to start going and pushing real hard, Brian, does that start to feel a little sensitive? So it's going to feel a little sensitive. So we don't want to go past a 4 on a pain scale of 10, 1 being almost nothing and 10 being the worst pain you ever felt. 4 is on that border of where it feels kind of good and where it starts to feel a little painful. So give me a number there, Brian, as we go up. About a 3. Okay, so that means we're at the right pace. So I go all the way up from the knee to close to the hip as we can. What this actually goes and works on is that there is a line of tension. This is what's called the functional back line, according to the Anatomy Train's book with Thomas Myers is the author of the Anatomy Train's book, who describes this as a line of tension going from the opposite shoulder to the right shoulder, going all the way across the back and down to the opposite hip. So you can go and release this, because if this gets tight, it can basically have torsional patterns around the body. So as we go up from the knee all the way up, and I can kind of feel different tension as we go up. So about 6 to 8 strokes should be necessary. So now I'm doing this for him in the first try, but I want Brian to be able to do it himself. So go ahead, Brian, try to take that T-bar. And so bring the knee up a little bit closer and slide that right up your leg. Because again, not many people can afford a manual therapist doing this for them, at least not on a daily basis. So we want to be able to do this ourselves. So we take a T-bar, our neuromuscular T-bar, and be able to go up to like, what's the number on there? About 4? Okay, good. So about 6 to 8 times. Good, relax, okay. So then we would repeat that, again, we can repeat that for the opposite side. So starting down from the knee and working your way up to the hip. And this has been the neuromuscular T-bar self-manual therapy of the lateral hamstrings and iliotibial band.